I am here today to talk to you about trauma specifically. So trauma and then other psychological responses to IV nutrition and tube feeding. I have nothing to disclose today. So I wanted to give you an overview of the presentation and then talk to you a little bit about why I was even asked to do this. I think, again, my bio is a little bit of a mouthful, so I'll tell you a little bit more about me and then we can get going. So today I'm going to talk to you about trauma and post-traumatic stress disorder. I think that there can be some confusion about what trauma even is and what PTSD even is. And then I'm going to talk to you specifically about what medical trauma is and how there might be some post-traumatic stress related to medical traumas and experiences that you may have had. I'm going to talk about general psychological responses to medical illness and IV and tube feeds. I'm not going to spend a lot of time on kind of the range of things people might experience because frankly, both Joy and Lauren talked a little bit about that. And then my colleague, Dr. Tiffany Taft, talked about that 2 years ago here. And I won't have time to get into everything. So I'll direct you to learn a little bit more about that. And then what I think is almost the most important part of the presentation, I'm going to talk to you about what to do, how to cope if you do have post-traumatic stress symptoms or experience a medical trauma, and then this concept of post-traumatic growth. So who am I? Why am I here? What makes me qualified to talk about this? In the introduction, you heard a lot, but I'm a clinical psychologist, which means I have a doctorate in clinical psychology. I specialize in working with adults and adults with medical conditions, helping them cope with the medical condition that they have and then change health behaviors in many cases. And within health psychology, I subspecialize in psychogastroenterology, which is again a mouthful, basically meaning that I specialize in working with patients with gastrointestinal conditions. I'm currently working at Northwestern Medicine within the Department of Gastroenterology. So I work alongside the surgeons and physicians and other healthcare providers and dietitians who treat people with the whole range of digestive conditions. And also that includes a number of people who use nutrition support therapies. I'm also working with Dr. Taft, who I mentioned earlier, on a number of research projects, one of which focuses on people who have inflammatory bowel disease and post-traumatic stress symptoms related to that condition. So what is trauma? Trauma is I think it's a commonly used word, and it can mean a lot of different things to a lot of people. When I talk about trauma, I'm talking about trauma according to what the Diagnostic and Statistical Manual of Mental Health Disorders defines it as, which is exposure or actual or threatened death, serious injury, or sexual violence. And most pertinent to us today is exposure to actual or threatened death and serious injury. So you can be directly exposed to this trauma. You could witness another person going through a traumatic experience. You can learn that a relative or close friend has experienced a trauma or have indirect exposure to a trauma, meaning like you're a medic or first responder. So it's not someone you know and you're not experiencing it yourself, but you're witnessing this through your work. In general, when you experience a trauma, this is such a significant threat to the physical integrity of your being or your body or your life that you experience these very intense thoughts and feelings. So fear, helplessness, and horror, which lead to a lot of physical reactions. When we face a traumatic event, I'm sorry, I just need to move the little picture of myself over so I can see my notes. When we experience a traumatic event, when we're faced with that, our body responds to this threat with the fight or flight response. So you might have heard of this called the fight or flight or freeze response, a sympathetic activation response, the stress response. But this is how our body wants to respond so that we can survive. It activates a whole range of systems in our body. So you feel increased heart rate and blood pressure, a change in breathing and muscle tension. There's activation of this part of our body called the hypothalamic pituitary adrenal axis, which just releases a lot of stress hormones and signals throughout the body, basically to help us activate and survive. So if we think about what this was, how this was adaptive before, if we were being chased by an animal, for example, we would want all of these changes to happen so we could escape and flee. But many times, the types of traumatic experiences that we have today, and in particular for medical trauma, is not a situation where we can run away from that, right? It's often an internal thing, and we'll talk more about that in a minute. So when people face a trauma, there are a number of different reactions. And after the trauma event, I'm sorry about the ambulances if you can hear them. I'm at the hospital right now. So after the traumatic event, the first couple of days, having responses like I just mentioned, that activation of the sympathetic nervous system, being on guard, having a lot of really intrusive thoughts or memories about the event, that's relatively normal. When we face a really scary situation, Joy mentioned earlier, fear of starving to death, right? Not knowing if you're going to be able to live without something. That's scary and it's impactful. So for a couple of days, we normally would feel a lot of different strong thoughts and emotions. If that lasts longer than 3 days, you actually would meet criteria for what's called an acute stress response. Again, this is very normal. Many people experience acute stress response to trauma. There are these different categories of symptoms that we group symptoms into. And if you have at least 9 symptoms across these 5 categories, then you would qualify for an acute stress response. So what does this look like? This looks like kind of replaying that event in your head. Avoiding reminders of the event, whether they're memories, internal reminders, or external. Feeling like really low mood, detached, not really able to experience joy. That hyperarousal I mentioned, being on guard, difficulty to calm down, kind of keyed up and being on edge. And then feeling detached, almost like having an out-of-body experience. This isn't reality, things aren't real, almost like you're in a dream. If it continues beyond, those kinds of symptoms continue beyond a month, that's when we would give a diagnosis of post-traumatic stress, or we would call those post-traumatic stress symptoms. Now, what I want to make sure I emphasize here is that this is not necessarily linear. So you can experience post-traumatic stress symptoms a month after the trauma without ever having had an acute stress reaction. Many people who develop an acute stress reaction with time, they actually don't go on to develop post-traumatic stress symptoms. And that experiencing a trauma does not actually mean that you'll experience any of these things. Trauma is actually quite common. About 60% of men and 50% of women experience a traumatic event at some point in their life. And only about 6 to 8% of people in the general population have post-traumatic stress or post-traumatic stress disorder. I also want to emphasize that after trauma, there's this possibility of post-traumatic growth. I'm going to keep moving on from here. We'll talk more about that in a minute. So I mentioned these earlier. These are the symptoms of post-traumatic stress disorder. We'll talk about them in the context of medical illness in a minute. But so to meet criteria for a diagnosis of post-traumatic stress disorder, you have to have experienced this traumatic event or witnessed it, had indirect exposure, and then experience symptoms that fall into each of these categories. So re-experiencing the trauma, avoiding the reminders of the event, having negative changes in thoughts or mood, and then alterations in arousal. So that's like being keyed up on edge, difficulty relaxing, hard to sleep. Okay. All right. So I'm seeing some questions come in. I just wanted to let you know that I can't focus on them, so I'm going to look at them at the end and I'll answer them. So why are we talking about this today? Why are we talking about trauma? We're talking about trauma because medical events, as many of you know, maybe all of you know, can be traumatic. We might have an illness or injury that's sudden or life-threatening. There's often shock and loss associated with diagnosis and treatment requirements, things like supplemental nutrition. Treatment related to an injury or an illness may be unexpected or distressing. Joy was mentioning complications after a pretty significant course of surgeries. The hospital environment itself can be distressing. I mean, no one gets good sleep in the hospital. There's all the light, there's the wake-ups to take vitals, there's all the noise, there's the machines. There's either perceived or actual mistreatment by medical providers. The medical team many times is not the best at communicating things. And there can be confusion or hallucinations due to delirium. So if you end up in a delirious state, that's when you might be feverish, have confusion of an infection, and then things don't seem real, and that can be a very traumatic experience. Medical trauma is a specific thing that has been defined in the research and in the scientific community. So it's a specific set of psychological responses to medical experiences like injury, serious illness, pain, surgery or other medical procedures, and then frightening and distressing treatment experiences. Medical trauma is often thought to be unique from other types of trauma because many times external traumas have an end date, or they just are one experience and then they end, or a course of a couple experiences, for example, like combat or a car accident. Whereas medical trauma is more internal. And even if it's something like a surgery, you keep your body, obviously, your body stays with you. With supplemental nutrition, you're having this over and over again. There's this kind of constant threat. If I don't get this nutrition, what will my life be like? Will I live? So it's different. It's a distinct thing, although the symptoms are very similar. When we think about how these post-traumatic stress symptoms map on to medical experiences, that re-experiencing category is having recurring thoughts, memories, or even nightmares about the traumatic event. So that might look like replaying the memory of getting a diagnosis, replaying the hallucinations that you had when you were feverish during an infection, nightmares about being rushed into surgery. Significant emotional distress often occurs when you're facing reminders of the trauma. So sometimes when I meet people for the first time in my practice and I ask them to tell me about their experience or the course of their illness, post-traumatic stress symptoms often look like the people who can't even get through talking about it, or they start to talk about it and they become it might even be that they won't talk about it, right? So just a lot of emotional express when thinking about it, or, driving by the hospital. All of those things can be pretty psychologically difficult. And that, of course, causes a lot of problems in engaging in care. So there's this tendency to want to avoid reminders of the event, which makes it difficult to follow treatment instructions, understandably, and makes it difficult for people to want to attend their appointments. There may be negative emotions and thoughts that are very extreme, and inability to experience positive emotions. So people end up often with difficulty trusting others, including medical providers, feeling really isolated, like no one else can understand me. And this might occur whether or not people have post-traumatic stress in response to chronic medical conditions. But also just this thought that, my whole body is ruined forever. Like really extreme thoughts like that can be part of this whole cluster of symptoms. And then there is often, in terms of negative thoughts and emotions, excessive worry and hypervigilance. So people can get really keyed up and have difficulty relaxing, kind of always worrying about what's going to happen next in the care, when the next bad thing or complication is going to happen. And this might actually lead to the opposite of avoidance of the healthcare system, extra or excessive, in some cases, contact with the healthcare system, where every time you start to have a symptom, you get very upset and worried and call your doctor, which can be exhausting for you to have to keep worrying about this in such a significant way. So I've been talking a lot about some pretty heavy thing. Oops, I'm so sorry. This was not supposed to go so far. I want to keep in mind a couple of things. So, some people experience a trauma and then they have trauma symptoms after these events, and some people don't. Some people experience these acute stress symptoms I mentioned earlier, and then the symptoms go away after a day or two. It's completely normal. Some people qualify for a diagnosis of acute stress response, and then symptoms go away before the month is out. And then some people do have this post-traumatic stress symptom cluster and maybe meet criteria for diagnosis. And then there are people who don't have any trauma response to the trauma, but they have other psychological responses, things like grief, depression, anxiety, and in some cases even growth. So the key here is that everyone has their own set of responses. And this doesn't make you crazy or abnormal, or even like uncaring if you don't experience this, right? It's just that everyone has a different set of responses, and that's because of different backgrounds and different biology and different social contexts. So what are the rates of post-traumatic stress in people who have supplemental nutrition? Well, we don't have specific rates. There actually hasn't been research done on that to my knowledge at this point, but we do have rates of post-traumatic stress specifically in patients who are more likely to experience the need for supplemental nutrition. So rates of post-traumatic stress and inflammatory bowel disease have been found to be 21 to 26%. There's just recent data on this by Dr. Taft, who I mentioned earlier, which is high. For an ICU stay, rates of post-traumatic stress are about 22 to 24%, and GI cancer about 20%. So we're looking at 1 in every 5, 1 in every 4 people who have these experiences related to these chronic medical conditions or acute medical conditions can experience post-traumatic stress. And think about this compared to veterans or the general population. With vets and combat vets, that's 11 to 20%. It's much higher, actually, if you look at Vietnam War vets. But for most recent combat experiences, 11 to 20%. And then compared to the general population, about 6 to 8%. So this is definitely higher, and it's important that we're talking about this and thinking about this because, fortunately, post-traumatic stress is actually treatable. So again, I want to emphasize experienced trauma does not mean you'll develop post-traumatic stress. So I don't want to scare people when I'm talking about this. I do just want to make you aware of it because there are things that we can do to mitigate it, to prevent it, and to help you cope after traumatic experiences. So I wanted to talk a little bit about other psychological responses to nutrition support. To be honest with you, people who are on nutrition support are the experts on psychological responses to nutrition support. I have the data from the research, and I can share that with you, and I'm going to share that with you. Dr. Taft, like I mentioned in 2019, gave a really wonderful presentation on this, and you can find that on the Oley Foundation website. But again, it really varies person to person. And that's why you can see when you look at these numbers that these percentages are so wide ranging. A nice thing to think about is that most studies actually suggest that tube and IV feeding ultimately improve quality of life for people who aren't able to meet nutritional requirements otherwise. So 70% of people with home parenteral nutrition have reasonably good quality of life. That said, 10 to 80%, again, look at this range, this is really wide, have depression at some point. Attributed to TPN and enteral nutrition. 41% describe anxiety, 35 to 43% report social impacts, 27 to 60% report sexual concerns. These are wide ranging because of the various studies. 32 to 50% report difficulty traveling, 23 about half report fatigue, and then 11 to a quarter reporting decreased concentration, usually due to neurocognitive effects of nutritional deficiencies. I wanted to put on this slide up here, the next two, because what it emphasizes is that nutrition support can impact quality of life in positive ways as well as in the challenges. So I wanted to emphasize both sides of that. And I think, again, Joy and Lauren did a really nice job of this. So I'm not going to spend too much time on this, but nutrition support can create challenges initially as you're adjusting to it, especially with the loss of flexibility and spontaneity. It can be difficult to travel, as the last slide mentioned. There could be impact on sleep and role changes related to eating and having to adjust to that, and decreased autonomy. On the other hand, at the same time, what these research participants were saying is that there's also increased autonomy with nutrition supplementation because there are fewer emergent medical procedures, improved mobility, better life expectancy, improved weight, increased energy, and of course, improved nutritional status. As I mentioned before, post-traumatic stress and the symptoms hasn't been specifically studied in people who have who use supplemental nutrition. But what I highlighted in here is that when we're thinking about how nutrition support impacts quality of life, you do hear a lot about mortality, about death, about how it's either preventing death or fear of death without it. And so I think that, again, we can assume based on the numbers I mentioned earlier, and then also on the types of experiences people who have enteral nutrition and TPN, they go through, that there is probably quite a bit of post-traumatic stress in this group. So again, we want to make sure we're treating that. As Joy mentioned earlier, I was scared I would starve to death. And she said, that's kind of extreme, but this is actually kind of based on these quotes, pretty common thoughts. It rules your life. It's a case of you live or you die. So everything might revolve around it. You don't want to die, so you've got to have it. If I keep on it, I'm not going to die. I'm alive now. Without it, I wouldn't be. So again, these are heavy, scary things, which speak to the experiences that people may go through, especially in the initial phases of adjusting to nutrition supplementation. There are a number of different factors that can impact if people are going to go on to develop post-traumatic stress or depression or other things, other psychological responses that are difficult in response to nutrition supplementation. We think about this from a biopsychosocial perspective. I said here, a biopsychosocial just basically means there's a lot to consider, right? And that's why no two people have the exact same response. This is a patient-centered perspective. It's really kind of capturing the complexity of the co-occurrence of medical and mental health conditions. And it also demonstrates that we need to be addressing this in practice. So unfortunately, there are not a lot of GI psychologists. There are not a lot of psychologists integrated into these practices, and there needs to be. So we need to continue to advocate for that. In the service of time and to focus on things that you can do to cope, I'm going to skip ahead, but these are just examples of the biological and event factors that can impact response to chronic illness and traumatic events, the social factors, and then psychological factors, with one of the number one things being if you have a history of trauma, repeated traumatic events, that does make you more likely, more at risk for later development of post-traumatic stress. So let's talk a little bit about how to cope and about this thing called post-traumatic growth, because this is really what we want to do with this information now that we have it. So for those of you who aren't familiar with Viktor Frankl, he's a psychiatrist. He is a Holocaust survivor. And a quote from him that is, you've probably heard before, but if you haven't, I thought it was just really applicable here, is that, you know, many times we can't change a situation. It's happened in the past, or we have to keep facing it, keep enduring something that's difficult. And so then we're challenged to change our response, as Lauren said, kind of shift our perspective, and as Joy said, find joy. Everything can be taken from us except for the ability to choose our own attitude. I think that that's incredibly applicable, especially after experiencing a traumatic event. Post-traumatic growth is a term that was defined in the mid-1990s to describe that people, this thing that people kept seeing over and over again, is that after trauma, people like Viktor Frankl, people like war veterans, and people who survived intense accidents and medical traumas actually end up sometimes experiencing, and often experiencing, positive effects that develop as a result of the struggle with the trauma. And what that looks like is that after a time, people have a reevaluation of how they understand themselves, others in the world, as they make meaning out of what they experienced. This is distinct from this concept of resilience. Resilience is thought to be kind of this ability to bounce back after a traumatic event in the short term, but this is a longer term concept. It's kind of maybe the initial struggle, you didn't bounce back right away, but you were able to, from this post-traumatic growth, actually build resilience for the next event. A large numbers of studies shown that this occurs in probably about 30 to 70% of people who've experienced trauma. And what they see in the research, and this includes things like cancer, HIV, heart attack, brain injury, stroke, that people might experience greater appreciation for life, improved or closer relationships with others. They find that their relationships might be enhanced in some way. They come to value their friends and family more, experience an increased sense of compassion for what other people are going through. I really loved how Lauren said, you know, this person's just another human. I think that's a really important perspective to have as you're going through and interacting with different people. They experience this idea of new possibilities in life, so kind of finding a fresh appreciation of what each day might bring and what really matters, kind of shifting values. Increased sense of personal strength and resiliency, a greater acceptance of vulnerabilities and limitations, but also a greater use and kind of leaning into strengths, and then spiritual change. So what should you do after a stressful or traumatic medical experience in order to grow from it, and in some ways to prevent post-traumatic stress? And I think this is critical. The first and number one thing is just give yourself time. So I laid out kind of that timeline for you. 1 to 3 days, it's really normal for this to rock your world. I mean, it's going to affect your body. It's going to affect your whole being. And so giving yourself some time, being patient. Up to 30 days, again, acute stress response is incredibly common after a trauma. And then you might move into the realm of post-traumatic stress. And that's when we really want you to consider seeking professional attention. So initially, just give yourself time. Get back into your daily routine, or try to find a new one. And then these two things are the things I'm going to talk about more because they're critical for preventing post-traumatic stress. And that's processing the trauma by talking about it or writing about it, and learning how to calm down the stress response. Okay. Now, taking care of our physical health can be difficult sometimes, right? Sometimes you have to change wound dressings and deal with infection. You have to deal with the difficult pain and physical parts of whatever your chronic medical condition is and of nutrition supplementation. And that can be uncomfortable. And you kind of do it because you need to. The same is true for emotional healing from difficult experiences. Interacting with the emotions and thoughts and talking about these experiences can be really uncomfortable and painful at first, but it's also critical to health and healing. Avoidance is a natural reaction, but it does put you at greater risk of developing or continuing to have these acute or post-traumatic stress symptoms. So first thing to say is try to talk about it. Find a friend or a partner, another supportive person you trust. You don't have to talk about it with anyone you don't want to talk about it with, but just find someone to talk to about it. Maybe a fellow patient, maybe a support group, maybe people who you meet through the Oley Foundation. You can also write about it. Research shows that writing about it can be just as effective at helping you cope with the trauma. So you can make an Instagram post or write in a journal, make a blog post, but either way, processing it. Learn how to calm down the stress response. There are a number of different ways you can do this, but using progressive muscle relaxation, diaphragmatic breathing, guided imagery, to the extent that you're able to engage in physical activity and going on walks can be really helpful. Practicing meditation and learning biofeedback. There are a number of other self-help resources that you can use both to help talk to people, so connecting with other patient support group organizations, but then also to learn how to calm down that stress response. And so they're here. I think they're going to share my slides after, so you'll have access to this. And then please don't hesitate to reach out to professionals if it's needed. There are psychological treatments developed specifically to treat post-traumatic stress symptoms. These trauma-focused treatments are the gold standard. They're well-researched. They all do involve direct processing and discussion of that event. They include things like, these are what you want to look for when you're looking for a trauma therapist, a person who knows cognitive processing therapy, prolonged exposure therapy, trauma-focused cognitive behavioral therapy, or EMDR, which is eye movement desensitization reprocessing. Professionals can also help with other things like learning new pain management strategies, promoting adjustment to new lifestyles or limitations, addressing depression. If you are feeling depressed, know that there's a difference between feeling blue every now and then in response to big life changes like this and this persistent low mood and not enjoying things for 2 weeks or longer. If you're feeling depressed, please talk to someone about it and you can get help. Depression is also treatable. You can learn new coping strategies, improve communication with caregivers and medical providers, and then increase positive emotions and well-being, which is something I think we could all use, that dose of joy. Here are different ways you can find a professional. So I think when I clicked briefly on the questions, this did pop up at first. So for a general therapist, Psychology Today has a wonderful therapist provider that lets you search with different topics. You can search trauma, chronic medical conditions. You can search for a man or a woman if you have a preference, or non-binary. There are insurance filters, so there's all different filters. And then there's a website for psychologists who specialize in working with people with GI conditions. That's romegipsych.org. Okay, in conclusion, many people on nutrition support experience multiple traumatic events, and that increases their risk of developing post-traumatic stress. Some people experience post-traumatic stress, others do not. Both things are possible and normal, and acute and post-traumatic stress are treatable. So processing traumatic experiences by talking about it with support of others can help prevent acute stress from turning into post-traumatic stress, or writing about it. And a silver lining after trauma is the potential for this post-traumatic growth. I do not have time to attend a panel this afternoon to answer your questions, so please feel free to reach out to me with questions. You can contact me at my email. I'm also on Twitter and on Instagram as well. Thank you.